Hello and good evening, afternoon, morning to everyone, depending on where you are in the world. Thank you very much for joining me. I'm Dr. Philip McMillan, and today I'm going to go through my Vejon COVID-19 Review 2022 highlights. I thought I'd do this today because it's going to be difficult on New Year's Eve. Nobody probably wants to listen to me talking about this on New Year's Eve, but today is the 30th of December, and I thought I'd share a few points. Now, I'm going to cover it from a few different angles. One, what seemed to do well on YouTube and thinking about why the relevance as to what I thought is was important with regards to my Substack, and also talking about some of my research and work in terms of long COVID. So I hope not to make this too long, but just to share with you some of my thoughts as to what I thought was quite relevant with regards to the year of 2022. And I think I'm going to start with where I was with regards to December 2021. And this here is from I'm going to show you something from my Substack. And this is from December. Once I get it all ready, there you go. There you can see it. This was a post that I did in December 3rd. Who is more at risk of the COVID-19 Omicron variant, vaccinated or unvaccinated? And I asked that question because very early I saw that we were probably going to face a challenge with regards to what was happening in terms of the evolution of the pandemic. And that was a very, very important instinct that I had that has proved to be relatively correct when we look at where COVID 19 is in terms of at the end of 2022. Who would have predicted that the pandemic would not have been over? The other point that I had made with regards to the end of 2021 was I made the link to autoimmunity in COVID 19, aligning it to the movie Don't Look Up. And essentially, what I was saying in that movie, if you haven't seen it, was that the main protagonist or the star of the movie was essentially trying to warn everyone about the comet that was coming. And no one wanted to listen because it was inconvenient politically, financially, and they didn't look up. That's one of the concerns I had then, and it's still a concern today. We seem to be afraid of looking at the science. And whilst looking at the science can be challenging and concerning, it doesn't help anyone if we don't actually focus on what actually could happen in the context of the science around COVID 19. So there are many views out there, but I'm very simple in my approach. Focus on the science, look at the science, always reflect on the worst outcomes because that's what you prepare for. If it's better than that, it's wonderful. No need to be concerned. When we think about YouTube and the videos that I've done over the past year, I've done quite a few. I'm doing a few more recently. The standout one was in the middle of the year, and I'll highlight it again in my Substack, COVID-19 vaccinated deaths. This had over 250,000 views over the year from it was made. It's an important topic and one that I highlighted. If you look in my links, and if you're on YouTube, you will see it as one of the featured videos. I think it's important to look at as I analyze the deaths around people who had been vaccinated for COVID-19 vaccines. It's an important consideration. At the time, only 29 autopsies were done, one published study, and sadly, I don't think I found any more towards the end of 2022, which is an absolute embarrassment for the scientific and medical industry that we don't have more autopsies. The other video that seemed to do very well on YouTube was the COVID 19 treatment conspiracy. I suspect the word conspiracy is therefore going to be drawing the attention. In reality, it was just focused on the fact that we had seen research around steroids quite early on being beneficial, Why didn't we complete the research? What were the reasons behind it? And the conspiracy idea essentially comes out of the fact that maybe there were other activities that was pushing the system not to look in more detail at a treatment option. That was what the topic was about. It seemed to resonate with regards to the audience on YouTube. When I think of my Substack, and for those of you who don't know my Substack, and I encourage everyone to join me on Substack, part of the reason I did that was because I was finding at the time that on social media you had to be so careful when you thought of the science. I couldn't freely express what I was looking at with the science, some of the concerns, some of the challenges, because so much would have been considered to be misinformation. The problem is that when you look at science, that's all it is. You are reflecting the science, you're looking at it carefully, and you're trying to anticipate where things will go. So this is why I encourage people to be on Substack, because that's where I can freely express some of those ideas, and I can only do it in part here in the general social media. So when I look at my review of the Substack from when I had done it, probably last year, at the end of last year, I put it together. Here is quickly, month by month, what I thought were the standout posts that I did that are important to me, not necessarily to people, but to me. The first one in January was this one with regards to increased mortality across Europe for age 15 to 44 year olds. I thought this was absolutely huge because this was a 9 times increase in terms of mortality for the younger age groups in 2021, higher than 2020. I was really concerned about this. I sent out emails, posts, comments, messages to as many people as I thought were relevant, because I thought this needed to be investigated. Sadly, I don't think it got enough attention, and we're seeing that excess mortality across the world is still rising, and we still haven't done the analysis to try and work out exactly why this would occur. So that was my standout point in January 2022. In February, my standout post I picked was that of the ethics of COVID-19 vaccination in children. And this was a presentation with Dr. Ross Jones from the Heart Group. And in it, she was explaining why she thought it important that we don't vaccinate children. And that was her view. And she went through the science as to why she took that perspective and came out very strongly with regards to how we should approach vaccination in children who were low risk for severe disease. And it's well worth a listen. And that was in February of 2022. It's still relevant today. In March, I have selected the presentation with Geert van den Bosch, the recent white paper from Geert van den Bosch. And this was Geert doing the detailed research on the pandemic. And sadly, for those who haven't yet read his work, most of what he has predicted has already occurred. Probably not in terms of the severity of it, but he was very concerned in March 2022. His predictions with regards to what would happen with regards to Omicron were about accurate. And this was a standout presentation from Geert, and all the information is there for anyone to review. So I'd certainly encourage people to try and do that. That is an important piece of work that was done by Geert. In April, what I went for as a topic is the pandemic over in Africa? Remarkably, this post had gotten censored on LinkedIn because I dared to look at the science and observe that Africa had low levels of Omicron compared to other highly vaccinated regions. Well, you can see what's happening today. And what I had done was just observe and pick up the science of what the trajectory would be like with regards to the pandemic. That has borne out today, and we are starting to understand a little bit better as to why that's occurring and why it's actually important. So that was my main review with regards to April of 2022. In May of 2022, I'd focused on the autopsy review. That's a presentation that's in the Substack, and it's worth a listen because it was showing that in the vaccinated cohort, there was increased viral dissemination. So we were noticing the fact that the vaccinated cohorts were not able to control as effectively spread of virus in the body. That's very important. And we see this playing out now. And it's close to one of the points that I had recently done, one of the very important points with regards to SARS-CoV-2 co-infections, where you have COVID and other viruses coming together to form a co-infection. That one is occurring today as we speak, increasing in frequency, and it's certainly something for us to look out for. Subsequent to that, I have selected one important post that I had done on Substack with regards to critically analyzing all aspects of COVID-19 vaccines. And I said this because I am pro-vax. I'm not challenging the science of what happens with COVID-19 and the science around COVID-19 vaccines just for the sake of it. It's because I think it is so important that we treat this carefully because it can damage long term the public view of vaccination generally. The assumption will be if COVID vaccines are either unsafe or not as effective as we had hoped, it would therefore be a reflection of every single vaccine that we use. I think that's a very dangerous precedent and one that it certainly requires us to look at. So it was a point that I thought was very, very important. In July, again, I highlighted this COVID-19 treatment conspiracy, and I'll not spend too much time on it, but it is a very important listen to understand why steroids, a critical part of the treatment of COVID-19, hasn't actually been used efficiently in the context of the correct type of steroids and the correct dosing. And so that's certainly an important point that one needs to look at. In August, I actually got censored for this post is, are you prepared for the COVID-19 tsunami? And again, I was looking forward to the winter and saying that my anticipation was that if we are still having high levels of Omicron circulating, we are going to face a tsunami of disease when we come into later 2022. Now, I am clear when I did anticipate that this would be an issue towards the end of 2022, but it's still an issue, but not as high as I thought it would be. But in that post, I had highlighted that I thought that the excess deaths after the year could be over 100 million. That's a frightening amount and certainly not something that we should ignore. But I did certainly think this was very, very important. In later on, that's now in September, I went and followed the Biden statement with regards to the fact that the COVID-19 pandemic was over. I think he must have been talking about Africa, was the point I was making, where red is where Omicron was spreading. And if you look at the circled area here, you can see that Africa is largely Omicron free. That's still how it is today. And for some reason, from a scientific point of view, instead of us studying this and trying to understand this, we seem to continue to ignore what is an extremely critical scientific observation. And so this is a very important point for us to look at. As you can see, I'm not afraid of challenging the science and asking hard questions. So, of course, in October of 2022, I was then deleted from LinkedIn. LinkedIn was a very important place for me where I was able to share and challenge a lot of the scientific viewpoints. And for some reason, they decided that my posts and my comments and my analysis of science was therefore misinformation. It was a sacrifice to do scientific censorship. I did try my best to stay within the bounds, but it was so difficult when you saw people saying things that were clearly unscientific. to not challenge them and to put forward to them some different perspectives with regards to how the pandemic was and continued to evolve. Then in November 2022, the SARS-CoV-2 patent question is the one that I've highlighted. I think this is an extremely important point, and it's only now starting to get more traction. The fact is that the SARS-CoV-2 virus that causes COVID-19, the furin cleavage site is a patent. It's patented. Why is that the case? Is that meaning that it was produced in a lab? It's quite remarkable to me that scientists are not interested in this, because why would this, if this was created in a lab, let's just say that, this should be of tremendous interest to every single person across the world, because it would be relevant to what could occur if we ignored it. That to me is definitely something that everyone should listen to from a scientific point of view. The person who had gone to pick this apart and find the patent on it purely by accident. And so he deserves great credit for doing that piece of work. And so that's a lot of what I had focused on with regards to COVID-19 and the science around COVID-19. But the other part of my research, and as I emphasize to people, is that I am focused on research. I'm focused on science. And so how could you be focused on science and not actually focus on long COVID? Now, a lot of my audience thinks long COVID is completely irrelevant and made up. I can't understand why when so many people are affected by it. And this is the highlight from the Long COVID Coalition. This is where a number of people have come together to try and bring the best minds on long COVID. And this was in June of 2022. We had our fourth Long COVID Coalition Congress. So it was very important, I thought, to focus on the science around long COVID, because it is a critical part of the disease. There are many people who are suffering with this, and we need to understand exactly what is happening with regards to the disease. And that led me to create a completely separate Substack. So I have the Substack where I focus on the science of COVID-19, but completely separate to that, I've created a long COVID analyzed Substack. And this is it here. And this one here is just focused on looking at my thoughts and research around COVID-19, long COVID, and sharing some of the presentations that had come through the Congress, listening to some of the research that had been passed through with regards to long COVID. And I've been covering this now for at least 6 months. But even prior to that, I was looking at long COVID with regards to having some of the very first conferences where we pulled people together all the way in April 2021, looking at long COVID and the presentations around it. So this is the science around COVID-19. The science is not particularly interested in the opinions. It's just looking at what is happening and trying to reflect on how we can understand the disease better. Now, listen to me as we come to the end of what I hope will be something that's valuable to you, as I encourage you to join me on Substack as well. I will mention as well another one of those standout videos that I've done, and I listened to it again just today to reflect on it, the silent disease vaccine-induced myocarditis. This is an extremely important presentation because it highlights the fact that we may be seeing subclinical myocarditis across the population. And this is relevant when we look at sudden cardiac death. Really, really important for us to deal with some of these issues and look out for them. So my view is simple. The science around COVID-19 needs to be thoroughly analyzed. We need to continue to be objective in the science, not being afraid to see and challenge what may be incorrect approaches to a very complex disease. I'd like to highlight to those people who still think COVID-19 is a non-entity, that it is just another flu, that it is no different from what we had before, and that the numbers have been exaggerated. There is truth in all of that. But let me tell you something very important. Never before have I lost colleagues at work from just a standard flu. This is very different with COVID-19. For those who work in the healthcare industry, we know how frightened we were, certainly in the first wave and even the second wave of the pandemic. We know how it felt when colleagues were lost. And if there is one thing that I can do for the sacrifice of those healthcare workers who lost their lives or became very unwell through COVID-19, applying as much science and research to the disease is my way of remembering and contributing to their lives. I hope that everyone will realize that we are still in the midst of a pandemic. We are not yet over. And to be frank with you, my worry is that we're coming into the most difficult part of the pandemic. And so I warn and encourage everyone to be vigilant. Continue to follow me because I'm going to try and give as many solutions and strategies as I think are relevant. And believe me, you will always be ahead of the science, sometimes a year ahead as to identifying what can happen next. Please join me on Substack, and I'd encourage you all to have a great evening.